If you've ever experienced a canker sore, then you know how painful and frustrating they can be. So is there a way to prevent them or to make them heal faster? Let's discuss. I'm Dr. Sam Ellis. I'm a board-certified dermatologist in Northern California, and I'm here to help you understand your skin. So if that sounds good to you, give this video a thumbs up and don't forget to subscribe to the channel. The first thing I want to make very clear about canker sores is that they are not the same as cold sores. Canker sores, also known as aphthous ulcers, are small, shallow, painful ulcers that occur inside the mouth, typically inside the lips, on the tongue, and inside the cheeks. Now compare that to cold sores, also known as herpes labialis, caused by the herpes simplex virus, and those are typically on the outside of the mouth, on the lips or on the lip border. And probably the biggest difference to understand is that canker sores are not contagious, whereas herpes is contagious, and they are very different. The only caveat I'll make to that is the very first time someone has a manifestation of herpes, it is often inside the mouth, and it can be those similar painful ulcers, but this is often accompanied by systemic symptoms, so feeling maybe flu-like, having a sore throat, or just achy. So you can get cold sores inside the mouth, though that's not most commonly where they're going to show up, but you cannot get canker sores outside of the mouth. So again, canker sores are not contagious. They are these white, oval-shaped ulcers in the mouth that often have a red border, and they are characterized by being pretty painful. If you're prone to repeated canker sores, we call that condition recurrent aphthous stomatitis. And recurrent aphthous stomatitis can be subdivided into different categories. The most common is minor aphthous stomatitis. And this category really encompasses what the vast majority of people who experience canker sores experience, which is small, so less than 1 centimeter ulcerations, usually not having more than 5 ulcerations going on at one time, and those ulcerations usually healing within 1 to 2 weeks. And even with minor aphthous stomatitis, you can get recurrent lesions throughout the year, but you definitely don't have continuous lesions in the mouth. We can contrast that to major aphthous stomatitis, which is typically defined by larger, deeper ulcers. So we're thinking ulcers larger than 1 centimeter, things that are deep and can take weeks to even months to heal. Typically with small canker sores, that is what we call a spot or visual diagnosis. As a dermatologist, we can look at that and go, yeah, you have canker sores. However, if someone has major aphthous stomatitis and is getting really large sores, we may want to biopsy that to rule out other inflammatory conditions or even a squamous cell carcinoma in the mouth. Having really large or persistent canker sores can also be a sign of underlying HIV. So if anyone is ever presenting with signs of aphthous stomatitis major, we often will screen for HIV. And lastly, canker sores can have this herpetiform pattern, so herpes-like pattern, and that can be the trickiest to kind of tell, well, are they having canker sores or are they having a herpes outbreak? But with a viral swab, you can tell the difference. This is usually characterized by numerous, very small canker sores that are clustered together, and this tends to happen to people later in life. But again, it is not the same as herpes. Herpetiform canker sores are not contagious. Overall, canker sores are really common. It's estimated that 1 in 5 adults in the United States is going to deal with canker sores. They tend to be more common in children and young adults. They're also more common in women, and it would actually be pretty rare to start developing canker sores after the age of 40. Now, when we think about the causes of canker sores, it's something that's been explored for a while, and there's no definitive answer, but it's thought to be due to some type of immune dysregulation. We also know that canker sores have a very strong genetic link, so if you get canker sores, there's a good chance one of your parents does, and if you have kids, they might be prone to them as well. We also see canker sores develop in people who have certain vitamin or micronutrient deficiencies. Now, that's not very common in the United States, but nonetheless, if someone has new onset, recurrent, bothersome canker sores, we will often do a vitamin screen and look for things like vitamin B1 levels, B6, B12, folate, zinc, and vitamin D. We will also often screen for iron deficiency. And then if the patient has symptoms that are suggestive of another disease where canker sores could be a symptom, we will check for that as well. So for example, people who have lupus can be prone to oral sores. So if someone has other signs of lupus like photosensitivity and joint pains, we might screen for lupus as well. Canker sores can also be associated with inflammatory bowel disease like ulcerative colitis and Crohn's disease, as well as celiacs. So if someone also has a lot of gastrointestinal symptoms, we would screen there. But the reality is canker sores are so common and are so rarely associated with these conditions that unless someone has significant symptoms that suggest a different etiology, we don't do any laboratory screening for canker sores. It's also worth mentioning that there are a few medications out there where canker sores can be a side effect. So for example, methotrexate, which is used in a lot of rheumatological conditions, as well as beta blockers, which are used in cardiac conditions. There's also some association with NSAIDs, so things like ibuprofen. So if you're someone who takes ibuprofen regularly and you get canker sores, it might be worthwhile to stop that and see if your canker sores get better, if that makes sense for your overall health. Now, if you are someone who is genetically predisposed to canker sores, there can be certain triggers for these canker sores. So let's talk about them, because when we're talking about intervening on canker sores, trigger avoidance is a huge part of that. The number one trigger of canker sores is local trauma inside the mouth. So whether that's biting the inside of your cheek or gnawing on it, if you have any type of dental appliances like braces or a mouth guard or dentures, if you have a poor fit, that can also trigger canker sores. So it's really important that if you use any of those dental appliances and you think it might be getting triggered, to make sure that you are fitted properly. Also, if you have braces or a retainer that tend to rub on your gums or on your teeth and cause problems for you, you can think about using things like wax to smooth out the contours of your braces or retainer so that they're not bothersome. There have also been some associations of canker sores with sodium lauryl sulfate, which is used in toothpastes as a cleanser. So if someone gets a lot of canker sores, I will often have them cut SLS out of their oral care routine. So for example, toothpastes like Sensodyne and Tom's of Maine and David's are all SLS free and are good options. A lot of times people will ask me as the dermatologist, well, are there any like food triggers for canker sores? And there have been no distinct food triggers associated. However, if you notice that every time you eat tomatoes or citrus or chocolate, you get worsening canker sores, then you might want to avoid those. Also, citrus or tart things can make a canker sore feel a whole lot worse because they are acidic and you have an open sore. So avoiding sour or tart things when you have a canker sore flare can help with symptoms. And then lastly, it should be noted that canker sores can be triggered by hormonal shifts as well as stress. Like, what isn't triggered by stress, honestly? So anything you can do in your life to reduce stress, have a more healthy lifestyle is going to help with these. The vast majority of people who suffer from canker sores are never going to need to see a physician about it or seek medical care. However, we should talk about things that should prompt you to seek medical care. First of all, if you have an unusually large sore that is not healing over many weeks, that needs to be evaluated because of course it could be a canker sore, but it could be something like a squamous cell carcinoma, so a skin cancer inside the mouth, or indicative of a different inflammatory condition. Also, if your canker sores are so painful that they are preventing you from eating, drinking, talking, or they're causing you to lose weight or disrupt your social life or your work activities, they need to be evaluated professionally. And then of course, if you have sores that are extending beyond the inside of your mouth onto your lips or outside of your mouth, that needs to be evaluated because that's not a canker sore. In terms of treatment and therapies for canker sores, number one is going to be trigger avoidance, whether that's foods, SLS, limiting stress, all of those things are going to be really important in reducing how many canker sore flares you have every year. You also want to make sure that you are practicing good oral hygiene. There is some suggestion that alterations of the microbiome within the mouth may make you more predisposed to getting canker sores, so you want to make sure that you are brushing your teeth and flossing regularly. And you also want to be doing that gently. So sometimes switching over to a soft bristled toothbrush can be beneficial. But let's talk about what you should do if you actually have a canker sore that's bothering you. Things you can do at home that don't really involve any products are saline swishes or baking soda swishes. So you can take a teaspoon of baking soda and dissolve that in about half cup of warm water and swish with that a few times a day. Or you can take a quarter teaspoon of salt and dissolve that in a quarter cup of water and swish with that a few times a day. That can help reduce discomfort and may help your canker sores resolve faster. You can also purchase over-the-counter products that help with discomfort by numbing the area that you have canker sores. So things like Oragel, Xylactin B, Canker, these are all topical benzocaine preparations that can numb the areas so that you can just get a little bit of pain relief. They also sell hydrogen peroxide rinses that can be helpful for some people with canker sores. So if you're noticing that the pain relief isn't doing the job, you can always add these in to see if it helps your canker sores resolve faster. There's also some small studies to suggest that supplementing with vitamin B12 or a multi-B vitamin can help canker sores and reduce how much they happen to you. So the interesting thing about this is it seems to help even if you are not vitamin deficient on a laboratory study. So if you're someone who suffers from a lot of canker sores, maybe you even had a laboratory workup, I think it's worthwhile to try vitamin B supplementation because it's so low risk and you might get a lot of benefit. But of course, before adding any supplements to your routine, I think it's good to check in with your healthcare professional. In terms of prescription things, my go-to as a dermatologist is to prescribe a topical steroid, so something called clobetasol gel. I use this not only for people who have canker sores, but people who have other inflammatory conditions of their mucous membranes in their mouth or in their genitals, and it works really well at reducing the pain of the canker sore and helping it resolve faster. There are also different preparations of oral mouthwashes that can help with discomfort. So there's something called Magic Mouthwash that has things like Benadryl and Maalox and lidocaine in them, or benzocaine in it, to help with numbing the mouth and making things a lot more comfortable. I would often prescribe this for my patients when I worked in a hospital setting if they were having oral ulcerations from chemotherapy or radiation, but they can be helpful for really bad canker sores as well. There are also other oral medications that can be prescribed for canker sores like colchicine and dapsone, but those are typically reserved for people who have aphthous ulcers due to other underlying conditions like Behçet's disease, for example. My overarching advice for someone who suffers from canker sores is 1, avoid your triggers, and 2, if you're noticing the onset of a canker sore, to intervene quickly. If you're someone who suffers from them a lot, I think it's not a bad idea to check in with your primary care provider or your dermatologist to get a prescription for a topical steroid that you can use in times of discomfort. Now, I always feel like canker sores are one of those things that people have lots of good home remedy recommendations. So if you have any of those, definitely let me know in the comments. I hope this video was helpful. If you have any questions about canker sores, never hesitate to reach out. Thank you so much for watching. Don't forget to like this video and subscribe to the channel, and I'll see you next time.